You're watching the Randy Alvarez Marketing Report. I'm Randy Alvarez. Today's topic, how to jumpstart your hygiene team. With us, we have an expert on the topic, Heidi Arndt. Heidi, welcome to the program.
Thanks for having me.
Now, you were a dental assistant, also a hygienist.
Correct.
And kind of worked your way up
I did.
into managing, I guess, over 1,000 hygienists. Now, for people that don't know you, because you're a consultant to dentists across the country, tell me a little bit about your background, your training, kind of where you've been, and where you are now.
Absolutely. Well, I started off my career working at the Mayo Clinic, which was a wonderful experience. I worked with medically compromised patients, patients with severe periodontal disease.
And I have to interrupt for a second because you said you were a powerhouse hygienist. What does that mean when you say that?
I was a hygienist that produced well above what the other hygienists did in the practices that I worked with. And I also had the ability to really partner with the doctors and help them develop really strong treatment plans. So not only was my revenue great, the doctor's revenue was great too. So I took what I knew how to do and started sharing that with other hygienists. And at that point, I took over managing about 30 hygienists and mentoring and coaching them how to be more effective and perform better.
Large group practice?
It was a large group practice, yeah. And when I worked with those 30 hygienists, we were able to increase revenue by 20% across the board, which is a big increase for dental hygiene in a practice. Later on, I was promoted to the National Director of Dental Hygiene for American Dental Partners, which they have over 250 practices, and I was managing $145 million of hygiene revenue from about 1,000 hygienists.
So 1,000 hygienists, and you were what, writing the protocols? What was your role?
What I would do is I would go into the practices and I would train and coach them on protocols and how to improve performance. A lot of what I coach on is behavior changes, how to better care for the patient and kind of tap out of your own mindset, old mindset, and go into a new mindset of how you're going to better care for your patients. And
they brought in more revenue because of it?
Absolutely. Absolutely. Okay. Year after year, we were seeing a minimum of 10% increase. And when you're looking at $145 million, that's a lot of money.
Interesting.
Yeah.
Well, good for you. Then what was next?
I loved my job at American Dental Partners. It was very rewarding. I worked with a group of wonderful people, but it had always been my dream to start my own business. So at the beginning of 2011, I started that dream and began Enhanced Hygiene. And now I work with dentists across the country, helping them to do the same things that I did at American Dental Partners.
Who is your typical dentist that you see nowadays? Is it the big group? What is it?
You know, I have a mixture, Randy. I have some really big groups with 30+ practices, and then I have some solo dentists with one hygienist that I work with. So I have a big variety.
So you offer, I guess, a couple of different programs for dentists.
I do. My two most popular programs is, the first one is a strategy day, where I will go into the group and I first do a lot of groundwork and I complete an assessment of the group and look at the opportunity for that group. I go in and I work with their leaders and help them develop a strategy and an implementation plan that they can take and do themselves. I will not be doing the coaching, I'll be guiding them from afar. And then I do my check-in points every month for 3, 6, or 12 months, whatever they decide to do. But it truly gives them the roadmap and the steps necessary to be profitable. They just use their own manpower to coach and implement it.
So what kind of results can they expect on that strategy implementation session, that one day in their practice?
My clients see about a 20% increase the first month after that one-day strategy session.
Okay.
Now, my best program, or my premium program, is the 12-week program that I offer, where I actually go in and I work with the office and help them implement the changes. And that's where my superstar client comes into place, where they were increasing revenue by $30,000 in the first month.
Is that right? The very first month?
First month.
So what's the key there? I mean, how does it increase that much that fast?
We went in there.
Just techniques, selling techniques with the hygiene team?
For them, it was their schedule. That was the biggest thing. I saw that right away from the opportunity assessment that I did, that their schedules were a mess and not effective. So we went in and revamped the schedules. And then the next thing we did is we coached the hygienists on how to present treatment, how to address obstacles with the patients, and how to get the patients to say yes.
So the 12-week program, you are how many days in their office over the 12 weeks?
I spend 4 days in the office initially to help them, to train them, and then help them implement, because you want to implement as soon as you train them.
Are they consecutive days?
They are consecutive days. So I'm a part of their team for an entire week, basically. Then after that, we do a phone follow-up every month. I do a call with the doctor to make sure that everything is going well from a management standpoint, and then I have a team call to make sure I answer any questions and help building on the implementation that we've already done.